Traditional rulers, distinguished guests, ladies and gentlemen, good morning, and welcome to the ceremony this morning to showcase equipment and human resources that are supporting the COVID-19 response program in Ghana, especially at a time when Ghana prepares to fully reopen its educational institutions. As you would recall, last night, His Excellency the President, in his address to the nation, mentioned that from this month, January, schools of all levels will reopen. The reopening is in a staggered process, starting from kindergartens going through to tertiary institutions. Throughout this week, there will be a number of engagements to update the Ghanaian public on the various exercises that are being undertaken to ensure that schools can reopen safely. This morning, we are starting with two of such engagements. First, by the ministry responsible for education, outlining the details of the school reopening program. And second, here, showcasing in partnership with our partners or with our colleagues from the private sector, the equipment and human resources that are supporting with the disinfection and preparation of schools and other public places as we step up the COVID response program. I'd like to welcome you on behalf of the Ministry of Education and the Ghana Health Service and invite the Ghana Health Service led by Dr. Patrick Kumar-Boaji to join us and give us the latest on the COVID updates as we prepare to showcase the equipment and human resources with which we are responding to the COVID program. Thank you and welcome once again. Let's welcome Patrick Kumar-Boaji and his team with a round of applause.
Thank you very much, Honorable Minister, for the opportunity to share updates on the COVID-19 situation as of today. I will be talking about a summary. What are our cases, our recoveries, mortalities, what is happening at the Kotoka International Airport, how is our hospital admissions, what will be our updates in the school reopening as far as the health sector is concerned. Ladies and gentlemen, as of the 1st of January, we have recorded 55,220 cases. And we've done about 74,000 tests, which brings it to about 21,512 tests per million population. Our positivity, that is the population who have been positive, is about 8.2%. Unfortunately, we have recorded about 3,658 health workers who have been affected. 54,005 have been discharged so far. We've also unfortunately lost 333 cases. And currently, as of today, the number of active cases, that's the number of people who have carried the virus, is 879. Majority of the active cases, about 52% of them are all in Greater Accra. Currently, all 16 regions and 243 districts have reported cases, leaving about 17 districts that are yet to report a case since the outbreak of the pandemic. We have had the epic curve. We've had a lot of confirmed cases, and if you take a look at it, as at November, our cases were higher, but from 7th of December after the election, the number of cases have remained flat, and it's actually shown a slight decline compared to the pre-election figures. We are having an average of about 75 cases a day. And that shows in our moving average, that shows that about 75 cases a day on the average are being reported. And that has shown a decline across since the election and even before the election. So far, 5 regions have no active cases, and these are Savannah, Bono, Western North, Northeast, and OT do not have any active cases. 5 regions, Upper East and Upper West, have less than 10 cases. And Greater Accra, as I said earlier, has the highest number of cases. In the last few months, most of our cases have come from Accra. That is, starting from September, a significant number of cases have all been in Accra, with the rest of the country being relatively quiet as far as the COVID cases are concerned. If it comes to the number of deaths, apart from the May, June, July, where we had a peak of deaths because we also had large number of cases, the last few, from October, almost all the deaths have come from Greater Accra region, which means that we need to be very careful where we are, especially in Accra, to be able to contain the pandemic. As you know, about 75% of all those who have died have some comorbidity, and so that is why the Ministry of Health and the Ghana Health Service is focusing on non-communicable disease, which has been a major challenge as far as surviving COVID is concerned, apart from age. We still have hypertension, diabetes as the main causes of the comorbidity, and that is why we want to focus on managing non-communicable diseases. One of the key things that we have also discovered is the fact that a large number of the people died, about 85% of the people die in the first 24 hours of admission, which means that reporting early is critical, and those who die a week are fewer. And so the earlier report is quite important for us to be able to contain not just the virus, but also reduce the mortality and the death that accompanies the condition. We've opened the Kotoka International Airport since the 1st of September, and we have recorded cases there. As you are aware, we are doing a 2-tier test. You do a PCR negative before travel, and on arrival we test you, and probably that's the only very few countries that are conducting such an exercise. We have so far recorded 741 positives from September when the place was opened. We have been able to discharge about 74% of all those people who tested positive. Currently, 191, which is 26% of the people, are still carrying the virus, and we have been monitoring them. We have so far not reported deaths from those who tested positive at the done about 120,000 tests with a positivity of 6.2%, which is slightly lower than the general average here. But what is interesting is the fact that in the last December, the numbers have been going up over the months. We started seeing an increase in October, November, and December was a major peak. We recorded 46 cases in September, 98 in October, 169 in November, and as at the end of December, we have recorded 393 cases. We are in January. In the very first few days of January, we have recorded 36, which shows that the number of cases that are coming, that would have been imported in the country, is high and would have been cumulatively gone up. So you can see that for the positivity rate, the number who are there has increased from 0.6%, 2% when we started in September to 1.2%, which is a significant increase in the risk of people who are coming in and the disease. So that makes the policy quite useful. And this is what has led to the new guidelines on how do we manage this increasing case. Because as long as Europe and Americas are reporting high cases, we are also going to have to deal with large number of cases. We've also realized that those who are supposed to self-isolate, those who are not keeping because they feel they can self-isolate, have not been managing that properly. And so the new guidelines, as was mentioned by the President yesterday, tomorrow, all cases will be triaged at the Gan East. And by the triage, we mean that we'll test you, see your health, state of health. Are you sick do you have any other disease? And then based on that, the decision will be made by the clinicians as to what to do. They also instituted a mandatory 7-day isolation in the designated sites, after which you'll be tested, and if you are negative, you are discharged. Even passengers who tested positive at the Kotoka International Airport, because of the high risk on where they are coming from, we continue to follow them up by calls and see, and also advise them that if you see any changes, please report. So far, of the 800, almost 900 active cases, we have a total of 81 cases on admission. 77 of them are in Accra. That tells you that Accra is still the epicenter of the problem, and we need to adhere to our protocols very much. That also shows that there's not been any increasing trends as far as the cases are concerned. You can see that in Greater Accra, which is where the cases are, the number of cases on admission, the number of new cases on admission has plateaued and remained the same, and we are not seeing any increases. And it's something that we want to work on harder and also see the number come down. I think as part of our effort to contain the disease, one of the key strategies is approved by WHO and by the FDA of Ghana. One, if possible, that we can use our current cold chain system to manage. We're looking at our cold chain's ability to be able to look at that. Is it efficacious? And of course, I'm sure the issue of cost will come in. And I'm sure the team will continue working on getting this stage to be able to, our next step of fighting the pandemic. Importantly, is the reopening of schools. We've been out of school for nearly a year. As part of that, we have enhanced our collaboration with the Ghana Education Service and the Ministry of Education. All senior high schools have been mapped to health facilities across the country. A few months ago, we conducted a nationwide assessment to see the condition of infirmaries and clinics, and made some national guidelines out of that. And those who do not have are clearly mapped up. And we are also working on upgrading infirmaries to ensure that those who are in school are safe and are able to respond appropriately. The medical screening for all people, all SHS people, will be institutionalized and be done annually. And that will also be including my first day in school for the newly kids who are coming to school, something we need to look at. So the preschool and lower primary will be monitored as well and supported with the using currently existing school health platforms where health workers go to the school, visit, and of course we have them map up to health centers and hospitals where rapid response can take place. Teachers are being oriented on what to identify, risk conditions and refer, and how to repair. To continue to make the school safe, we will continue providing the masks, institutionalization of wash facilities, and I must say that that is something that we must really take it very seriously, institutionalization of water and sanitation facilities. We provide them Veronica buckets. Because of the increased hygiene, because of the COVID in the last year, as has been mentioned, last year Ghana did not record any case of cholera. We also had a significant reduction in all diarrheal diseases, and about under 5 children who have diarrhea reduced by almost a third. And that is something we need to look at. We will continue disinfection of all schools to make the place safer as the school reopens. Most importantly is to abide by the protocols is by ensuring that we do the risk communications. People understand what we are talking about, change their behavior to avoid infection, and that the objective is to encourage especially the children to observe the COVID-19 protocols in a way that are keen to them. You can see that the kindergarten kid may want to have a red or exchange a mask with a friend, etc. These are all things we are working on. We have to make them take responsibility for their own safety and that of their family and friends in an enjoyable and fun way. So we are going to do an entertainment education program that will be coming up to ensure that we continue educating, especially the KG and lower primary. We want to increase the understanding of the COVID-19 knowledge on how to stay safe, using measures that are simple and visual and entertaining, as I mentioned. The target will be children from primary 1 to 6, GSS and SHS, and of course their parents, to ensure that we all continue improving our cousins. So, Ms. Honourable Minister, with these words, I want to thank you all for this opportunity to share the update with you. Thank you very much.
Ladies and gentlemen, please give him a round of applause. Dr. Patrick Abuaje-Kuma is the Director General of the Ghana Health Service. So, ladies and gentlemen, later we will move into our second part of today's program, which is the exhibition of machines and trucks and human resources that have contributed to our fight against COVID-19. That exercise will be performed by the Minister for Sanitation, the Honorable Mrs. Cecilia Abena-Dapa. That will be later, not now. But right now, we will take a breather and watch a short video, after which we'll have a message from the Managing Director of Zoom Lion Ghana Limited, Mrs. Gloria Nti. So while we prepare for that message, we can watch this short video.
In the wake of the coronavirus disease that has hit several areas of our beloved country, several measures have been put in place to combat the virus by government, non-governmental institutions, and individuals. His Excellency, the President of the Republic of Ghana, Nana Addo Dankwa Akufo-Addo, in his second address to the nation on measures being taken by his government to contain and prevent the spread of the virus, tasked the Ministry of Local Government and Rural Development to liaise with the relevant authorities to improve hygiene standards in our markets, lorry parks, and public places.
The Ministry of Local Government and Rural Development should coordinate with the Metropolitan, Municipal and District Assemblies measures to enhance conditions of hygiene in markets across the country.
In March 2020, Zoom Lion Ghana Limited collaborated with the Ministry of Local Government and Rural Development and other relevant institutions to successfully undertake the phase 1 of the nationwide disinfection, fumigation, and cleaning exercise, which largely contributed to the containment of the spread of the virus. According to the World Health Organization's policies and standard operating procedures on the cleaning and disinfection of environmental surfaces, in the context of COVID-19, periodic disinfection of public places and surfaces where people gather are some of the ways to contain and reduce community spread of the deadly virus. For this reason, the government, through Ministry of Local Government and Rural Development, in collaboration with Zoom Lion Ghana Limited, has begun the second phase of a nationwide disinfection, fumigation and cleaning of major markets, lorry parks, and public places. The exercise was launched at the Independence Square by the Greater Accra Regional Minister.
I'm very happy to join you this morning to share a few words with you at the commencement of this important national disinfection, fumigation and clearing of markets, lorry parks and other public places in all MMDAs in the Greater Accra region. The Greater Accra region is embarking upon the second phase of the disinfection, cleaning and fumigation exercise, which will cover all markets in the region.
Honorable Ishmael Achite, who reassured Ghanaians that we can defeat coronavirus by obeying the strict preventive protocols put in place by the President, Nana Akufo-Addo.
If we observe the safety protocols that has been outlined for us by the health professionals, that's when we wash our hands with soap under running water, practice social distancing, and wear face/nose mask, we will be contributing to curtailing the spread of the virus.
The Zoom Lion disinfection and fumigation teams.
Thank you very much, ladies and gentlemen. Whilst the documentary was being shown, we were sanitizing the podium to get ready for our next speakers. Let me also acknowledge the presence of MMDCEs who have gathered here. Thank you so much for coming. This program is live on Ghana Television and all our partner media houses, including Joy News, Asempa FM, Joy FM, UTV, the Ministry of Information social media handles, as well as on other state agency social media handles. Right now, ladies and gentlemen, let me invite to speak to us the Managing Director of Zoom Lion Ghana Limited, Mrs. Gloria Anti, as she makes her way to the podium. Please give her a round of applause. Oh, I can hear the clap. Oh. Thank you very much.
Good morning, ladies and gentlemen. Honorable Cecilia Dapa, Minister for Sanitation and Water Resources. Honorable Atachia, Minister for Works and Housing. Honorable Kojo Oponkruma, Minister for Information. Honorable Mama Afo, Deputy Minister for Aviation. Honorable Kweku Ajimamenu, Minister for Health. Honorable Ishmael Ashite, General Greater Accra Regional Minister, and all other ministers of state present, members of Parliament present, Chairman and members of the Parliamentary Select Committee on Health, Works and Housing, Local Government and Education, Metropolitan, Municipal and District Chief Executives, NIME, NAME, executives, boards of directors and staff of Jospon Group of Companies, members of Pest and Vector Control Association of Ghana, PVAG, friends from the media, distinguished ladies and gentlemen. Let me be the first to wish us all a happy new year, a new year full of prospects and opportunities for all. In the midst of the novel coronavirus pandemic last year, the government of Ghana was recognized and lauded by its peers as one of the best in Africa in terms of its response and efforts in curbing the spread of the virus. This was achieved through the concerted efforts of government and other public and private sector players, including Zoom Lion Ghana Limited and its partners. I wish to thank His Excellency Nana Addo Dankwa Akufo-Addo and the people of Ghana for believing in, supporting the private sector, and providing the opportunity to serve our nation, especially in the fight against the COVID-19 pandemic. Permit me to also express my profound appreciation to the various ministers of state and the ministries of Sanitation and Water Resources, Local Government and Rural Development, Health, Defense, Aviation, Information, Education, and other agencies for their support in this fight against COVID-19. I also thank the Chief of Defense Staff, Lieutenant General Obed Akwa, and the Inspector General of Police, Mr. James Opon Bonu, and other security institutions who have been with us throughout all the disinfection exercises, out of which we acquired a lot of practical knowledge in handling emergency exercises. Special appreciation goes to the Metropolitan, Municipal, and District Chief Executives and other stakeholders for their support in undertaking the nationwide disinfection exercises. This morning, we are gathered here to showcase a fleet of state-of-the-art disinfection and fumigation vehicles and equipment used in supporting government's efforts of drastically reducing the spread of the pandemic. Let me also start by expressing our profound gratitude to the 7,000 personnel and other partners who made huge sacrifices of undertaking the nationwide disinfection exercises in all parts of the country. The occasion is also to indicate our readiness and the partners in the pest and vector industry to undertake the nationwide disinfection of all our educational institutions and schools as they prepare to reopen on January 15, 2021. In this regard, we have procured a wide range of state-of-the-art disinfection vehicles and equipment, including 50 atomizing vehicles, 10 street disinfection trucks, 5,000 motorized spraying machines, 5,000 knapsack spraying machines, 100 disinfection drones, and 5,000 handheld spraying machines. In terms of workforce, Zoomlion alone can boast of over 7,000 spraying gangs across the country who have been well trained with skills and the art of disinfection by the internationally recognized Noguchi Memorial Institute for Medical Research. In order to share our professional experiences, we have also established an association with a primary objective to control pests and vector and diseases through fumigation and disinfection. The association is referred to as the Pest and Vector Control Association of Ghana, which is also known as PVAG for short. This association has over 10,000 spraying men ready to serve Mother Ghana when called upon. Last year, Zoomlion, through its implementing agencies, Vector Pest Ghana Limited, and other government agencies, disinfected over 6,000 markets, 31,450 schools, various public places, including over 5,000 churches and mosques, all airports, regional centers, as well as military and police centers across the country against COVID-19. COVID-19 is still with us, and we need to continuously plan and build our human resource and logistical capacity to prevent its spread through effective disinfection and good hygiene. The theme of the event today, as aptly states, is making Ghana safer and healthier. We believe that these nationwide disinfection exercises, which are being undertaken by WHO recommended chemicals and technical advice from Noguchi Memorial Institute for Medical Research, for the training and guidance, has the potential of sustaining the gains made in containing the spread of the COVID-19 and make our public places safe for life to bounce back to normalcy. We in the private sector continue to pledge our commitment to supporting any government initiative that will help to make Ghana a safe and healthy environment to attract investors. On this note, I wish to commend the organizers of this exhibition for making this possible, and I wish you all a happy new year. Our appreciation also goes to other partners, such as the Noguchi Memorial Institute for Medical Research and members of PVAG for their input and support. Let me end by thanking the television stations, radio stations, and print houses, and other online media platforms for their continuous support. Thank you all for your attention, and may the good Lord bless us all and make our homeland Ghana strong and healthy. Thank you.
Ladies and gentlemen, please once again give her a round of applause. The Managing Director of Zoomlion Ghana Limited, Mrs. Gloria Enti. Shortly, we'll be led by the Minister for Sanitation, accompanied by some ministers to inspect a parade while we also take a look at the cars, the machines and equipment that have contributed in our fight against COVID-19. While we prepare to receive the Sanitation Minister, let me also announce that there are stands here for our exhibition, and the exhibition is being championed by the Pest and Vector Control Association of Ghana. So the membership includes GEM Intercontinental Ghana Limited from Tema. There's the Lifa McLean Pest Control, the Makar Facility Services, Vector Pest Ghana Limited, Metropolitan Waste and Allied Service, the Barrick Pest Control Services, Kenem Consult Limited, Blue Rang Pest Control, the Infotech Royal Systems, as well as the Pest of Ghana Limited. Some of these companies have stands at the far end where the canopies are. So after the ceremony, please, you can walk in there and have a look at some of the materials and logistics that they use in their operations. Ladies and gentlemen, on this note, let's welcome the Minister for Sanitation, the Honorable Mrs. Cecilia Abinadapa, for her speech. Thank you.
Thank you very much, Mr. MC. This will be just a few remarks. Member of the Council of State, colleague ministers of state, deputy ministers of state, members of parliament, executive chairman and board members of the Jospon Group of Companies, ESPA members, NIME, NAME, MMDCs, security agency heads, distinguished ladies and gentlemen. It is indeed the day the Lord has made, and we'll all rejoice and be glad in it. We all know the reason for our gathering. We are here to witness and to look at the state-of-the-art equipment being used by ESPA members led by the Zoom Lion Group of Companies. It's always good to have a first-hand view of what they are doing and to see the equipment they are working with. I must use the opportunity to commend the Zoom Lion Group of Companies for investing heavily in these equipments to do the work that they are contracted to do. We, as a ministry, stand in solidarity with the Zoom Lion Group of Companies and also other ESPA members to do their work in the sanitation area. We have initiated the recycling projects in all 16 regions of the country. We have also partnered with them to do special cleansing and cleaning of all our major cities. We have also done, for the first time in the history of this nation, special evacuation of age-old refuse dumps, some as old as 100 years. There has also been a collaboration in the provision of special vehicles for monitoring of sanitation projects. And these were supplied to the Ghana Armed Forces and the Ghana Police Service, as well as some MMDCs to do their work. We are particularly happy that His Excellency, through his ingenuity and his compassion for the vulnerable, he has extended the free water supply to the vulnerable for another 3 months. And we call them the lifeline users and consumers of water, as well as of electricity. This will go a long way to heighten their hygienic practices and make sure that this epidemic is prevented in their midst. I know that what we couldn't even achieve in 10 years, this short period that His Excellency provided this exemplary leadership in the prevention and eradication of this pandemic, we have achieved in the area of sanitation vis-a-vis personal hygiene, environmental hygiene, etc., etc. I know that we shall all continue to observe the COVID protocols, especially the hand washing and making sure we sanitize our hands and our homes and do constant fumigation. I use this platform to also entreat all of us to have our homes fumigated to rid them of pests and other dangerous animals. I know also that with all the efforts being put in place, Ghana will surely defeat this pandemic. I thank you and I welcome you And may the good Lord bless us all. Thank you.
Ladies and gentlemen, please give her another round of applause. And later this morning, the Sanitation Minister will lead in the inspection of the equipment and also inspect the guard of the human resource. Ladies and gentlemen, I'm privileged to introduce to you the Minister for Education, Honorable Dr. Matthew Opoku Prempeh, who has also joined us. He will share a few words with us, and then after that, we will have the exhibition and inspection. Please, a round of applause for the for education.
Thank you. Nanano, Naime, invited guests, members of the press, good morning. I'll first say I'm sorry for being late because there was an urgent meeting called in Parliament for newly elected MPs, and we had to attend. The little that I can say is that yesterday, 8 p.m., His Excellency the President addressed the nation. And in that address, he spoke about reopening of schools and the lessons that we have learned out of the pandemic. Schools are supposed to be reopened from the second week of January. And the President directed that all schools should be fumigated and disinfected before the kids, and as well as the provision of PPEs and observance of the COVID protocols before the students get in there. We hope that in partnering Zoom Lion and his companies and the sister companies that he works with, we can get the work done as quickly and as neatly and as efficiently and effectively as they've been doing to let school reopening happen on a smooth scale. We thank you, and we have observed the equipment that has been brought, and we hope that we'll be the first beneficiaries of the brand new equipment before probably they break down, so that it will be put to work in our schools, public schools all over the country, and private schools as well, so that kids can go back to school after a 9-month break. Thank you, and wish you all well.
Thank you very much. Another round of applause for the Minister for Education, the Honorable Dr. Matthew Opoku Prempeh. Once again, we'd like to thank all the ministers of states who are here. While the Honorable Education Minister was speaking, there were some more who were joining us. We also want to thank MPs who are here, the chairman of the various MPs in Parliament who are present here, the heads of state agencies, the heads of security agencies, the clergy, traditional rulers, leaders of various groups. We've supported the Market Women Association. Thank you so much for coming. Of course, all other stakeholders in our fight against COVID-19, we are grateful. Ladies and gentlemen, on this note, we want to invite all our ministers who are here, the Minister for Sanitation, the Minister for Education, the Minister for Information, as well as the Minister for Works and Housing. Please, if you can join us here as we begin our inspection of the equipment, as well as the parade of personnel who have been very instrumental in our fight against COVID-19. Our ministers will be taken round by Reverend Kwame Adai and Major Doc. So Reverend Kwame Adai and Major Doc. The Minister for Aviation is also here. He is also joining. So all ministers, in fact, if you're a minister or a deputy minister, you can join the entourage, Council of State members, MPs, you can also join the chairman of the various MPs. I've spotted the Deputy Minister for Agric, Honorable Kennedy Osei-Nyako is also here. The chairman of the Health Committee in Parliament, Honorable Dr. Komnetrum Niyama is also here. So all the MPs, all ministers who are here, please join as we inspect these logistics and equipment and also take part in the parade. Ladies and gentlemen, we will also want to plead that if we can have some of our traditional rulers join as well. The traditional rulers, the chiefs, Nime, Name. They will also join.
As I was saying, these are electrostatic machines that we use for disinfection. These machines are used in aeroplanes and sophisticated areas, offices where care must be taken during disinfection exercise. We also have a knapsack, and a knapsack that we put at the back of eye. We use them in an outside or inside, like the schools. These are the areas that we use these machines. We have a motorized spraying machine, the one at the back there. This is also used. Want us to use this place? We have new machines here that we want to also show to you. Aside this machine, we have hand thermal fogger machines. These are hand thermal fogger machines that we use for fumigation. It helps us where we need to fumigate in an enclosed area. These are the machines that we use. We also have drones. And these drones, these drones are also used in sophisticated areas, in an area spraying where we cannot use these electrostatic machines. So we have these drones, so that we use these drones from specific or difficult areas that we cannot walk to do the disinfection. We use this drone in the air to be able to get there because they are being displayed by human beings from far distance. So these are the drones that we use in assisting us to reach all the areas that human beings cannot walk in there. Besides this, these are also electrostatic machines. Yes, we have some over there. These machines, as soon as you start them, they are automatic. They do the work on their own. You don't need to be there, and it will work for you. Yes, please. Besides this, we have specific vehicle-mounted atomizers. These vehicle-mounted atomizers also help us when you want to do a mass disinfection. With a mass disinfection and a wide area where you cannot use human beings in doing, we have these big machines. We have, yes, please. I wish we could go closer so that we'll have a look at all these machines. Please, please be careful. Yeah. We have these pickup mounted atomizers, which we use in the difficult areas where we need massive disinfection to be done. And you need more, like the schools, like the airport, also at the stadium. We need these cars to be able to do the work perfectly for you. We also have a military and police branded machines, which we use during the disinfection. Since the disinfection involves people may not even allow you. They want to catch a glimpse of it. And therefore, we need the military and the police to be able to guide us so that we can have effective disinfection. So these vehicles also were used for the police to assist us to be able to go through the process successfully. Besides this, we also have big atomizers. And these big atomizers help us to be able to do a big roads like this tar floor, like the tarmac, also the air side of these are the police ones that we are just passing. But these are atomizers. Atomizers have, these are atomizers. New. We always keep on augmenting our equipment because to fight this pandemic, you need to be ever ready at each point in time when you are called upon. So we have beefed our equipment and material to be able to have the disinfection done within the shortest possible time. So these are what we call the atomizers. They spray from this end. We have the disinfectant in here. These are the mechanisms that use it. We have the mini ones, more than 20 of them. Then we have the big ones. No, yes, but these are the road sweepers. These road sweepers also, they help us do a road. You see, all areas at the school, we have two compartments. The one which is used for collecting dust, and the other part is also used for disinfection. So we have all these things at our mind, so that at each point in time, you're able to have a machine which is capable of doing what at each point in time. So that is what we have. And we have our sister companies and also Pest and Vectors Association of Ghana, who are also supporting in executing all these exercises. So this is how far we have come because of the love that we have for the nation. Exactly. And which is very, very fantastic. And it has helped us to be able to achieve such a marvelous and such a, take this. So this is how we have come, Honorable. And talking about, we have our spray guns. These spray guns, we have about 7,000 nationwide. But for the purposes of this ceremony, we need to display only 500 of them. They are spray guns, comprises of women and men, strong men of this nation. Yes, these are the people. These are the spray guns that have helped these organizations, especially Zoom Lion, Vector Pest, and their sister companies, and they have gone through for 10 months preparedness. To this end, we have some also here. Madam, Honorable Minister, we also have yes. Yes, we also have our military men.
They did with us. I must commend them, and we thank them for their service to the nation. Thank you.
Thank you very much. Thank you very much. We also have the Ghana Police at our far end over there, who has also done a yeoman's job, day in, day night, supporting us and protecting us from attack and also for successful disinfection. Normally, and we also have our tricycle supervisors. You know, at a point in time, we need to do cleaning before disinfection. And these are people who help us to be able to go through the processes. They are the back there, but these are the Ghana Police Service.
I salute you for your services to this nation. I know you joined us for all the special cleaning and cleansing services that we rendered. God bless you.
Thank you very much. Besides here on our right, we have our tricycle supervisors who has helped us through all the disinfection. And ESPA people, these are ESPA people, they are also part of ESPA, who has helped us to keep the country clean.
For the hard work they are doing, and they should continue with the good work. I will entreat them. They should practice good hygienic practice, because it's very important. The work you are doing, you must practice the hygiene yourself.
so that you can render a good service to the nation. Thank you also, and God bless you.
So, ladies and gentlemen, the inspection of the machines and equipment has just ended, and we want to we want to say a very big thank you to the ministers for sanitation, education, information, as well as works and housing, and all other ministers, MPs, heads of state agencies, our chiefs who accompanied the entourage for the inspection. Today is a very busy day for our MPs, so we don't want to keep them here for long. So we will just try and wrap up. But before we do that, here are some few announcements. All leaders of the various groups, please, after the program, come to the back of the stage here. There's a very important information for you. All leaders of the various groups, please. There's a meeting behind the stage with you, so please ensure to be there. We also want to say that after the ceremony, the exhibition will continue. The exhibition is being put together by the Pest and Vector Control Association of Ghana, which includes the following companies: Germ Intercontinental Ghana Limited, Lefa McLean Pest Control, Vector Pest Ghana Limited, Makar Facility Services, Metropolitan Waste and Allied Services, Barrick Pest Control Services, Kenim Consult Limited, Blue Rank Pest Control, Betch International Limited, Infotech Royal Systems, as well as Pest of Ghana Limited. Once again, we'd like to say a very big thank you to our media friends and partners, those who are carrying this program live on television and also on social media across the globe. Thank you so much. Also to all MPs who have gathered here or who made it to this ceremony, the heads of state agencies, the heads of security agencies, the clergy, traditional rulers, leaders of the various groups gathered here, and of course, stakeholders who are also involved in our fight against COVID-19. Ladies and gentlemen, we'd like to wrap it all up with a closing prayer, which will be done by Mrs. Adokale Okotipalo. Mrs. Adokale Okotipalo. Please give her a round of applause as she gives us the close. Oh, please, let's hear the clap. Thank you very much.
Thank you. With due respect, can we just be on our feet as we thank God for this wonderful time we've had together? If you can stand. So, Father, we just want to thank you so much for this successful program. We want to thank you for this capacity that you have given the whole nation. We pray that even as we've entered 2021, God, these equipment and this human resource that you have given us would enable us, oh God, even combat, oh God, even every coronavirus. In the name of Jesus, we pray that every company, every home, every minister, every staff, even of all companies, not only just one, will be protected